There's a couple of ways of correcting a thoracic lesion in the spine. If we just remind ourselves of what things look like, so if you have got a lesion on the left hand side, i.e. this side, then if this is the transverse process and this is the spinous process, what's going to happen is going to have gone like that. So what we want to do is make sure we stand directly opposite the lesion. And there's two ways. We can either use just the transverse process to correct it, and we can use a butterfly method. So what we do is we put the side of the lesion, i.e. the lesion's on the left, we put our left hand forward. So we always stand opposite side of the lesion, we put the hand of which the lesion's on the side of forward, i.e. so left lesion, left hand forward. And butterfly, what we're going to be doing is that. So you can see that that left hand will push this lower transverse process up, and the right hand will push this upper transverse process down. So that's one way we could do it. Or another way we can do it is to use the spinous process as the main lever. So you can see here the spinous process has tilted towards me. And remembering all the principles of manipulation, so you need to be at right angles to this, I'm going to use my thumb on that spinous process. I need to get my elbow right down so that it's in line with that spinous process. And my left hand, again left hand for a left lesion, will push. I'm doing the same as the butterfly. I'll use it to push that transverse process up. But in this case, the main leverage is on the spinous process. So the action will be this with this hand and this with this hand. So we're pushing with the thumb, keeping that elbow down and sort of steadying stroke, pushing down and up with this, because remember it's actually going to be a bit like this, that transverse process, so it's a little bit of downward motion as well, round like that, like the butterfly. So we put that into practice, then let's choose this one. Now remember with the thoracic that where the spinous process is, the transverse process will be a reasonable amount higher. So if we do the one with using the spinous process first, so I hook into the transverse process with the pisiform part of my left hand because it's a left lesion. If it was a right lesion, I'll be using my right hand here. We get my thumb onto the spinous process. We get everything so that it's 90 degrees to that spinous process. My elbow down. We ask the patient to breathe in. And as they breathe down, we follow that down and we just manipulate through with the thumb. Or this stays put. We now put the right hand on the other transverse process, we get right over the top of it and we ask the patient to breathe in and they breathe out, we follow it down and at the bottom of the breath we just manipulate it. And my hands did that. So you see that this left hand one pushed it up and the right hand one pushed this upper transverse process down.